Hey Panda Fam, today is day 1 of chronic illness A to Z. Disclaimer, these videos are just a short synopsis of disorders, and you should always talk to your doctor if you have concerns. Today we're talking about amplified musculoskeletal pain syndrome, or AMPS for short. AMPS causes an abnormal pain reflex, which creates constriction of blood vessels, and can deprive bodily structures of oxygen and cause lactic acid buildup. This means something that should be a 0 to 1 on the pain scale quickly becomes much higher. This is something called allodynia, or pain caused by a normally non-painful stimuli. The 3 main causes for AMPS are believed to be stress, other illnesses, and injuries. Most programs that treat AMPS use a non-pharmaceutical approach, using PT, OT, exercise, desensitization, self-regulation, and relaxation. These are intense inpatient and outpatient programs, and they're designed to help reset the nervous system to a more normal level, which means treatment in and of itself is hard and intense. If you have this condition, please do at this video tag me in your videos about it or comment in the comment section. We want to raise up the voices of people with chronic conditions. See you tomorrow for the letter B. Panda Fam, today is day 2 of chronic illness A to Z. Quick disclaimer, this is just a very short synopsis of a condition. As always, if you have concerns, please consult a medical professional. Today is the letter B, and we are talking about Bell's palsy. The exact cause of Bell's palsy is unknown, but it usually occurs after a viral infection, most commonly shingles, chickenpox, herpes simplex, or Lyme disease. The believed cause of the symptoms is swelling of the facial muscles, which is what creates the telltale symptom, drooping of one side of the face similar to a stroke patient. Other symptoms include dry eyes, drooling, and a change in the sense of taste or hearing. In most cases, Bell's palsy will resolve on its own, but some may require PT to prevent muscle atrophy or steroids, and in some cases the effects are permanent. Most likely, if you've had Bell's palsy once, you won't get it again, but it does happen. For some people, it can be a recurring problem. Join me tomorrow for the letter C. Any guesses? Panda Fam, today is day 3 of chronic illness A to Z. The usual disclaimer, this is just a short synopsis of a condition. If you are concerned, please always consult with a medical professional. Did you guess what C was? It is contact dermatitis. Well, yes, contact dermatitis is usually relatively common and relatively easy to treat at home with no medical intervention. It can become severe and lifelong. Contact dermatitis usually occurs from your skin coming in contact with something your body doesn't like, such as cleaning supplies, jewelry, or poison ivy, or sometimes something you're allergic to. And the treatment is usually at home with some sort of steroid or allergy cream. But as I said, in some cases it becomes severe and you must go to a doctor and seek medical attention for things like steroids, orally, and other treatments, as well as avoiding triggers such as things you're allergic to. Goes to show you that something that can be relatively common can have a very uncommon presentation. Join me tomorrow for the letter D. Any guesses? Panda Fam, today is day 4 of chronic illness A to Z. Usual disclaimer, this is just a short synopsis of a medical condition. If you are concerned, please always consult a medical professional. Today is the letter D. If you guessed delayed gastric emptying, you would have been right. The causes of this condition are generally idiopathic, which means unknown. But sometimes it can be attributed to things like inflammation, obstruction, or nerve damage from past surgeries or conditions like diabetes. Even if you know the cause, this condition is usually chronic and can last anywhere from a few years to a lifetime. Symptoms have a wide range, including abdominal pain, bloating, belching, vomiting, and feeling really full after a small amount of food. The treatments are just as varied. They usually involve gut motility drugs, antiemetics, and diet changes. In some severe cases, it could require a feeding tube. Any guess for the letter E? Join me tomorrow to find out. Hey Panda Fam, today is day 5 of chronic illness A to Z. The usual disclaimer, this is just a small snippet of information about a condition. If you have concerns, please always bring them to the attention of a medical provider. Today is the letter E for eosinophilic esophagitis. You have no idea how many times I had to say that. Or EOE. The causes of EOE aren't exactly known, but they believe it's a combination of allergens and genetics. Symptoms include dysphagia or difficulty swallowing, impaction from food getting stuck in the esophagus, chest pain that does not resolve with antacids, and regurgitation. Diagnosis is usually done through blood tests, biopsy of the esophagus, and upper endoscopies. Yep, they're going to stick a camera down your throat. Treatment's going to involve diet changes such as removing inflammatory foods, acid-blocking medications, liquid steroids that you would swallow, and sometimes they might recommend dilation or stretching of the esophagus. Tomorrow's the letter F. What do you think it's going to be? Panda Fam, it is day 6 of chronic illness A to Z. Usual disclaimer, this is just a small snippet of a condition, and if you are concerned, you should always bring your concerns to a medical professional. Did you guess what F was? That's right, we're talking about functional neurological disorder. No one really knows why this condition happens, but research says there are some things that make you more prone to it, like having another neurological disorder or high stress. It used to be believed that FND was purely a psychological disorder, but current research shows it is actually a neurological disorder, with psychiatric aspects. Symptoms are very broad, but include motor dysfunction like functional limb paralysis or tremors, sensory dysfunction, and altered awareness like dissociative seizures. Treatment typically involves physical therapy and psychological therapies like cognitive behavioral therapy. See you tomorrow for the letter G. Hey, Panda Fam. It is day 7 of chronic illness A to Z. Usual disclaimer, this is just a small snippet of a medical condition. If you are concerned, please always consult a medical professional. Today's the letter G. Did you guess Graves' disease? Graves' disease is an autoimmune disorder, where your immune system attacks your thyroid and basically sends it into overdrive. The exact cause of Graves is unknown, but it is most common in young to middle-aged females, and because it does tend to run in families, it's thought to have a genetic component. Graves is usually diagnosed with something called a radioactive iodine uptake test, because your thyroid needs iodine to produce hormones. If it's taking in too much, it's probably producing too much. Symptoms include high blood pressure, sweating, fatigue, anxiety, puffy eyes, hair loss, hand tremors, muscle weakness, and weight loss, among other things. Treatments for Graves range from meds like anti-thyroid agents and beta blockers to radioactive therapy, and in severe cases, they may remove your thyroid entirely. Join me tomorrow for the letter H. Panda Fam. Today is day 8 of chronic illness A to Z. Usual disclaimer, this is just a small snippet of information about a medical condition. If you are concerned, please always consult a medical professional. Did you guess what H was? Well, it's hypothyroidism. Hypothyroidism just means your thyroid is lazy. No, I'm just kidding, but it does mean that your thyroid isn't producing as much hormones as it should. Causes vary wildly, from autoimmune disorders like Hashimoto's, to thyroid surgery, to treatment for hyperthyroidism working too well. Symptoms can include fatigue, feeling cold, delayed puberty, hair loss, dry skin, enlarged thyroid, high cholesterol, slow heart rate, and weight gain. Treatment for hypothyroidism aims to rebalance the hormones that your thyroid has been slacking on making, which means you're going to be taking an artificial thyroid hormone called levothyroxine. I probably said that wrong. This is usually in meds like Levo-T and Synthroid. Tomorrow's the letter I. What do you think it is? Fam. Today is day 9 of chronic illness A to Z. Usual disclaimer, this is just a small snippet of information about a medical condition. If you are concerned, please always consult a medical professional. Today's I for inverse psoriasis. The cause of inverse psoriasis is basically like with other forms of psoriasis. The body's immune system goes haywire and basically causes an overproduction of skin cells. In short, it's an autoimmune disorder believed to be genetic. Triggers vary from person to person, but the most common are stress, injury, medications, infections, and moisture. Symptoms include patches of skin that are smooth, shiny, and red. They usually occur in places of high moisture, such as under the armpits. These patches may be hot to the touch, or painful or itchy. Treatment can involve steroid creams, UV light therapy, or certain medications. Hey, if you like this video, please interact with it. Like, comment, or share. It really helps the algorithm. Anyway, tomorrow is the letter J. Any guesses on what it could be? Hey, Panda Fam. Today is, shockingly enough, day 10 of chronic illness A to Z. Usual disclaimer, this is just a small snippet of information about a medical condition. If you are concerned, please always consult a medical professional. Did you guess what the letter J was? It's juvenile idiopathic arthritis. Let's break down the name first. It's a lot. Juvenile in medical terms means young, usually before puberty. And if you hear someone in the medical profession use the word idiopathic, it usually means that it occurred spontaneously and usually without a known cause. So here what they're saying is arthritis that developed in childhood with no known cause. Symptoms include joint pain, swelling in the joints, and some people might have rashes or swollen lymph nodes. Treatment can involve pain meds like NSAIDs, anti-rheumatic meds like methotrexate, and corticosteroids to reduce swelling. Hey, if y'all like this series, leave a like or a comment. And check out the link tree in my bio to find links to merch and the podcast. And join me tomorrow for the letter K. Hey, Panda Fam. Today is day 11 of chronic illness A to Z. Usual disclaimer, this is just a small snippet of information about a medical condition. If you are concerned, please always consult a medical professional. Today is K for Kawasaki disease. Kawasaki disease has no known cause. Theories range from bacteria to virus to environment to genetics. While it is very rare, it is most common in infants and young children. Symptoms involve abdominal and joint pain, GI symptoms, high fever, red peeling rash, pink eye, fast heart rate, and swollen feet, among other things. Treatment usually involves aspirin and IV immunoglobulin. Now, Kawasaki's disease is not chronic, but it is the leading cause of acquired heart disease in children in developed countries, which means it can very quickly lead to a chronic condition. Hey, if you like this series, please consider leaving a like, a comment, or a share to feed the algorithm. Maybe leave a comment telling me what you think the letter L is going to be, and join me tomorrow to find out if you're right. Panda Fam. Today is day 12 of chronic illness A to Z. Usual disclaimer, this is just a small snippet of information about a medical condition. If you are concerned, please always consult a medical professional. Today is the letter L for lupus. Lupus is an autoimmune disorder that is likely caused by a combination of having genes that predispose you to it and something in your environment turning that gene on, but they aren't really sure. Symptoms of lupus include muscle pain, anemia, fatigue, fever, hair loss, mouth dryness and mouth ulcers, anxiety, headache, joint stiffness, weight loss, and a red face rash that is usually known as a butterfly rash. Treatments consist of immune suppressants and lifestyle changes like diet modifications. Hey, if you like this series, please consider leaving a like, comment, or a share to feed the algorithm. Tell me in the comments what you think the letter M is going to be, and join me tomorrow to find out. Panda fam, today is day 13 of Chronic Illness A to Z. Usual disclaimer, this is just a small snippet of information about a medical condition. If you are concerned, please always consult a medical professional. Today is the letter M for myasthenia gravis. This condition is caused by an error in nerve transmission to the muscles. The normal communication between nerve and muscle is interrupted. Symptoms involve muscle weakness, particularly in the arms and legs, eyelid muscle weakness sometimes causing eyelid drooping, difficulty speaking and swallowing, double vision, fatigue, and shortness of breath. Treatments involve blood transfusions, muscle strengtheners, steroids, and a surgery called a thymectomy, or removal of the thymus gland. Hey, if you like this series, please consider leaving a like, comment, or share to feed the algorithm. And tell me in the comments what you think the letter N is going to be. You'll find out tomorrow. Panda fam. Today is day 14 of Chronic Illness A to Z. Usual disclaimer, this is just a small snippet of information about a medical condition. If you are concerned, please always consult a medical professional. Today is the letter N for neuropathic pain disorder. Neuropathic pain is described as a shooting, burning pain. It can go away on its own, but oftentimes it becomes chronic, hence the name neuropathic pain disorder. Causes can range from injury or surgery to alcoholism, chemo, diabetes, multiple sclerosis, shingles, amputations, thyroid problems. Really, anything that messes with the nervous system could potentially cause neuropathic pain disorder. Treatment will usually start with NSAIDs, anticonvulsants, and antisuppressants, but in some cases things like PT, acupuncture, massage therapy, and electrostim devices may be used. Hey, if you like this series, please consider interacting with it. Leave a like, comment, or a share to feed the algorithm. And check out the podcast Chronic A to Z on Spotify, Anchor, and Google Podcasts. Join me tomorrow for Today is day 15 of Chronic Illness A to Z. Usual disclaimer, this is just a small snippet of information about a medical condition. If you are concerned, please always consult a medical professional. Today is the letter O for osteopenia. Osteopenia simply means your bone density is lower than normal and can be caused by many things. Genetics, hormones, smoking, excess alcohol, being underweight, medications including anti-seizure meds and corticosteroids, malabsorption of nutrients due to conditions like celiac sprue, and chronic inflammation due to conditions like rheumatoid arthritis. Osteopenia is similar to osteoporosis in that it does cause lower bone density, but the bone loss is usually less severe in osteopenia, which doesn't mean it's not a concern, because it is. So diagnosis is done by testing your bone mineral density using something called a DXA scan. Treatment usually involves diet changes to increase the intake of calcium and vitamin D. Occasionally, bone strengthening medications will be used, but that happens very rarely. Hey, if you like this series, consider leaving a like, comment, or a share to feed the algorithm. And follow the tag on this app to keep up to date on all the videos. And check back tomorrow for the letter Panda fam. Today is day 16 of Chronic Illness A to Z. Usual disclaimer, this is just a small snippet of information about a medical condition. If you are concerned, please always consult a medical professional. Today is P for pressure urticaria. Pressure urticaria is an uncommon form of physical urticaria. Urticaria is a rash of wet raw. They usually itch, sometimes swell severely. It's an allergic reaction, but usually it's caused by foods. Physical urticaria types can come in many forms, including from heat, cold, and water. But pressure urticaria comes from a typically prolonged pressure on an area which causes an allergic response. The whole body can be affected, and besides the rash, people may experience fever, fatigue, chills, headache, and joint pain. And everyday activities like walking or sleeping can be affected. Treatments involve avoiding triggers as much as possible, antihistamines, and both topical and oral corticosteroids to control the allergic response. Hey, if you like this series, please consider leaving a like, comment, or a share to feed the algorithm. And check out our podcast Chronic A to Z on Spotify, Google Podcasts, Apple Podcasts, and Anchor. Check back tomorrow for the letter R. Hey, Panda fam. Today is day 17 of Chronic Illness A to Z. Usual disclaimer, this is just a small snippet of information about a medical condition. If you are concerned, please always consult a medical professional. Today is R for Raynaud's. Raynaud's is a condition in which small arteries that connect to the skin overreact to cold and therefore overconstrict. As well as cold, it can also be triggered by stress and anxiety. There are two types, primary Raynaud's and secondary Raynaud's. Primary means it occurs alone and is usually less severe than secondary. It is also more common. Secondary occurs in relation to other conditions, some of which are EDS, lupus, scleroderma, Sjogren's, RA, blood disorder, and thyroid disorders. Symptoms include a sensitivity to cold, white or blue color or red flushing, tingling pain, and sometimes swelling. It most often affects the fingers and toes, but it can affect the ears, mouth, and nose. Treatment usually just involves avoiding cold and other triggers and dressing warmer. Hey, if you like this series, please consider interacting with it by leaving a like, comment, or a share to feed the algorithm. And check out the Redbubble linked in my link tree to find disability-related merch. Join me tomorrow for the letter S. Leave a guess in the comments. Panda fam. Today is technically day 18 of Chronic Illness A to Z, but I missed yesterday. I'm sorry. I'll be posting 2 videos today to make up for it. Usual disclaimer, this is just a small snippet of information about a medical condition. If you are concerned, please always consult a medical professional. This episode is the letter S for slipped capital femoral ephesis. That's a mouthful. Let's call it SCFE for short. SCFE typically occurs in teens. It happens when the growth plate is damaged, and the femoral head moves or slips. The head stays in the socket, but it is not in line with the rest of the femur bone. This causes symptoms that mostly involve pain. Pain in the hip, groin, and knee, as well as sometimes a noticeable limp or a struggle with sitting with your knees facing forward. Treatment, unfortunately, always involves surgery. Doctors may ask you to use crutches even before surgery to avoid more of a slip, but you will have to have surgery to fix that growth plate. The second episode of today, the letter T, will be up shortly. If you like this series, please consider liking, commenting, or sharing to feed the algorithm. And maybe leave me a guess for what you think the letter T is. Hey, Panda Fam. Today is episode 19 of Chronic Illness A to Z. Usual disclaimer, this is just a small snippet of information about a medical condition. If you are concerned, please always consult a medical professional. Today is T for Turner syndrome. Turner syndrome occurs when someone who is assigned female at birth is born with one X chromosome instead of two. Symptoms include delayed puberty, short stature, high blood pressure, osteoporosis, heart defects, abnormal tooth development, lack of menstruation, infertility, frequent ear infections, kidney malformation, celiac disease, underactive thyroid. Really, Turner syndrome can cause a whole host of issues. Diagnosis would be done through lab testing to check the X chromosomes. And treatment involves things like growth hormones, estrogen, and fertility treatments. Only a small percentage of AFABs born with Turner syndrome can become pregnant without fertility treatments. The other treatment would involve just treating the symptoms as they come, like antibiotics for ear infections. Hey, if you like this series, please consider giving it a like, comment, or share to feed the algorithm. And come back tomorrow for the letter U. Any guesses on what it could be? Panda Fam. Today is day 19 of Chronic Illness A to Z. Usual disclaimer. This is just a small snippet of information about a medical condition. If you are concerned, please always consult a medical professional. Today is U for ulcerative colitis. Ulcerative colitis is an inflammatory bowel disease. The exact cause is unknown. They used to think it was caused by diet and stress, but they now just know that those aggravate the condition. They now believe that it is caused by an autoimmune disorder, but they're not sure. Symptoms include pain in the joints, abdomen, and rectum, bloating, bowel movement issues, anemia, fatigue, fever, weight loss. The list goes on. Treatment for ulcerative colitis ranges from medications like NSAIDs, antibiotics, steroids, anti-inflammatory medications, immune suppressants and dietary supplements, to surgeries, like a colectomy where they remove part or all of your colon, or surgeries to have a bag like an ileostomy or a colostomy bag. Hey, if you like this series, please consider giving it a like, comment, or a share to feed the algorithm. And check out the link tree in my bio to find the Chronic A to Z podcast, where we interview someone who has an ileostomy bag. Join me tomorrow for the letter V. What do you think it could be, Panda Fam? Today is day 20 of Chronic Illness A to Z. Usual disclaimer, this is just a small snippet of information about a medical condition. If you are concerned, please always consult a medical professional. Today is V for visual snow syndrome. Visual snow syndrome is a neurological disorder that affects the way visual information is processed by the eyes and the brain. The cause is unknown, but symptoms include tiny snow-like dots in the visual field, photophobia or sensitivity to light, palinopsia, or an image staying on your visual field even after you're not looking at any, and nyctalopia or trouble with night vision. Some people less commonly experience migraines, fatigue, and tinnitus or ringing in the ears. As of right now, treatment can only focus on the symptoms. You may see a neurologist, an ophthalmologist, or a psychiatrist for things like anti-seizure, antidepressant, and other medications or treatments. Hey, if you like this series, please consider giving it a like, comment, or a share to feed the algorithm. And check out my link tree in my bio to find disability-related merch through Redbubble. And join me tomorrow for a condition that starts with the letter W. Any guesses? Panda Fam. Today is day 21 of Chronic Illness A to Z. Usual disclaimer, this is just a small snippet of information about a medical condition. If you are concerned, please always consult a medical professional. Today is W for Waardenburg syndrome. I found like 6 different pronunciations of that on the internet, so I hope I'm saying it right. Waardenburg syndrome is a group of genetic conditions. There are 4 types, with varying symptoms. But most commonly, the symptoms include deafness or hearing loss, extremely pale blue eyes or heterochromia, pale skin, hair, and eyes, or what they sometimes call partial albinism, difficulty in straightening the joints, and those with type 1 will have wide-set eyes, as well as commonly a patch of white hair or early graying of the hair. Some may also experience intestinal issues. Typically, if you have Waardenburg, so do one of your parents, although the symptoms from the parent to the child may be different. Treatment involves treating the accompanying symptoms. Typically, it's for the intestinal issues. Hey, if you like this series, please consider leaving a like, comment, or a share to feed the algorithm. And come back tomorrow for the letter X. Any guesses? Hey, Panda Fam. Today is day 22 of Chronic Illness A to Z. Usual disclaimer, this is just a small snippet of information about a medical condition. If you are concerned, please always consult a medical professional. Today is X for xeroderma pigmentosum, or XP for short. XP is a genetic condition that inhibits the ability of the DNA to repair damage after exposure to UV light. Symptoms usually occur by age 2, and they can include severe sunburn and blistering after just a small amount of UV exposure, scaling of the skin, photophobia, skin cancer at a really early age, dry eyes, corneal clouding or corneal ulcers, delayed growth, muscle weakness, and hearing loss. Unfortunately, right now, treatment only involves protection. UV blocking clothes whenever you're outside, including long sleeves and long pants. the highest SPF sunscreen you can possibly find, UV blocking blinds on the houses, and UVA and UVB blocking sunglasses whenever you're outside, as well as treatment for any skin cancer that may occur. Hey, if you like this series, please consider giving it a like, comment, or a share to feed the algorithm. And check out the Chronic Illness A to Z podcast linked in my bio. Join me tomorrow for the letter Z. Any guesses? Panda fam. Today is day 23 of Chronic Illness A to Z. Usual disclaimer, this is just a small snippet of information about a medical condition. If you are concerned, please always consult a medical professional. Today is Y, for yellow nail syndrome, or YNS for short. They don't know why YNS occurs, but they're starting to think it has a genetic component because it does tend to run in families. The most characteristic symptom are extremely thick, yellow, and curved nails that seem to lack nail growth, as well as nails occasionally falling out. Occasionally, those with YNS will develop respiratory symptoms, such as fluid buildup in the lung membranes known as a pleural effusion, and swelling in the arms and legs known as peripheral lymphedema. Treatment is aimed towards symptoms, like antibiotics for respiratory infections, vitamin E for nail changes, and corticosteroids. Hey, if you like this series, please consider leaving a like, comment, or a share to feed the algorithm. And follow me on my other social media. There's an Instagram, a Twitter, and the podcast, and a YouTube channel linked in my bio. And come back tomorrow for the letter Z before we jump back to A. Any guesses on what Z might be? Today is day 24 of Chronic Illness A to Z. Usual disclaimer, this is just a small snippet of information about a medical condition. If you are concerned, please always consult a medical professional. Today is the letter Z, for Zollinger-Ellison syndrome. The cause of this condition is unknown, but they believe it's genetic. The characteristic symptoms include high stomach acid, ulcers in the stomach and intestines, and tumors that produce a hormone called gastrin. These tumors usually appear in the small intestine and pancreas, and they create gastrin. And they cause other health issues such as the ulcers, obstruction, a feeling of fullness, pain, and vomiting. Treatment is usually surgical removal of the tumors. If they can get all of the tumors, you can potentially be cured. But 1/3 of those with Zollinger-Ellison have a recurrence of symptoms after about 5 to 10 years. Meds to reduce stomach acid can also help reduce symptoms. Hey, if you like this series, please consider giving it a like, comment, or a share to feed the algorithm. And check out the next episode where we go back to the letter A and start all over again. What do you think A is going to be this time?